My name is Callie Hunter, Skills Lab Coordinator at North Central Missouri College, and today I'm going to be demonstrating how to do a focused neurological assessment. What I'm going to show you first is a Glasgow Coma scale. This is located on page 511 in your textbook. What this scale is, this is used universally. Most of you may have already seen this at clinical. What this does is this assesses your patient's neurological status in response to stimuli. And so based on the score that they receive, that gives us a good indication of really how they're doing neurologically. So the first thing we look at is eye opening and response. So if they are able to spontaneously open their eyes, meaning we go into the patient's room and their eyes are open when we first enter, we can give them a score of 4. If we have to arouse them to voice, and say their name several times, we would give them a score of 3. If we actually have to stimulate them, maybe rub on their chest or do anything like that, stimulate them to pain, that would be a 2. And if there's no eye response at all, that would be a score of 1, okay? Then we move on down to best verbal response, which is where we assess their orientation. If they are oriented, ANO times 3, we could give them a score of 5. If they're confused, meaning they're not able to answer your questions when you assess their orientation, maybe they answer 1 of them or only answer 2 of them, we could put them as 4, okay, confused. If inappropriate response, meaning maybe you ask them, what season it is and they tell you something that has nothing to do with the season, that may be an inappropriate response. If it's incomprehensible, meaning that they're mumbling or grumbling, they're responding but they're not really saying words at all, that would be a 2. And if they're not able to do any verbal sounds at all, that would be a 1. Next thing we want to do is assess their best motor response. So if they can obey commands, meaning maybe I tell them to grip my fingers and they do that appropriately, that would give them a 6. If they only respond to localized pain, that would be a 5. If they withdraw to pain, that would be a 4, okay, and on down through those. So the total score that they could get would be a 15, okay? Now don't be surprised if sometimes your patient does not get a perfect score of 15. In the elderly population, it's very common for them to be slightly confused, okay? But it's not really worrisome unless they're getting in the lower digits, okay, the real low numbers. If they're scoring maybe 13 to 15 in there, not really a concern, okay? So this is something that you should get familiar with. You will be using this a lot on your patients. What we're going to do today is we're going to do a focused neurological assessment on, we'll say, an 80-year-old female who fell and hit her head at home, hit kind of the back of her head, wanted to go ahead and just make sure everything was okay. And so we'll say at this point, the doctor just wanted to admit her, do some diagnostics, make sure she didn't have a bleed or anything like that, and we're going to do a focused neurological assessment. Okay, so the first thing I'm going to do is just knock and enter my patient's room. Hi, Brooke. My name is Callie. I'm your nurse today, and I see in your history that you have fallen at home and hit your head.
Yes.
And so what we're going to do is it just a focused neurological assessment. It just helps us to evaluate, make sure everything is okay.
Okay.
So I'm just going to wash my hands real quick.
Okay.
Can you tell me your name and date of birth?
Brooke MAQ00015 of XX.
Okay, very good. So already she was able to tell me her name and birthday. So those are very good signs. Okay, that's a good thing. Next thing I'm going to do is just carry on with her orientation. Can you tell me where you are right now?
At the hospital.
Okay, very good. And can you tell me the date or maybe what month it is?
No, it's January.
Okay, very good. And don't be surprised, guys. I can't remember the date half the time, so a lot of your patients may not be able to tell you the exact date, and that's okay. If you still sense that they're maybe slightly confused, sometimes patients, there's dates and stuff everywhere. They can memorize some of those things, but you still think they're confused. You may ask about what season it is or who the president is. Just something very logical that they would be able to answer. Okay, so we'll say at this point she's ANO times 3. And they did say you fell and hit your head,
Yes.
correct? Do you know when that happened? Was it yesterday? Or
Yes.
Yesterday.
Yes, yesterday morning.
Are you having any pain or anything back there? So I would, do a focused assessment of her head, make sure everything looked okay. I do feel that she does have a little knot on the back of there. Other things obviously I want to ask was if she maybe takes any type of blood thinner medication. Okay, anything that I would be confused about, possibly bleeding, okay, internally in her head. So that's why we're assessing these things. Oftentimes if there is a bleed, your patient's going to have symptoms of that, okay, whether it be in their pupils or their orientation. That's why we do a focused neurological assessment. So we'll say at this point her head looks good, it's been treated, they've done a CAT scan of her head. And the findings have been unremarkable. Okay, we'll say that they're good at this point. Can you go ahead just real quickly and squeeze my fingers? Okay, so I can see that her grips are equal and strong. Oftentimes if patients are having a neurological deficit, one side may be stronger than the other, one side may be weaker than the other. Same thing with signs of stroke. Okay, oftentimes patients may not be able to, have equal grips. Okay, that type of thing. So I can see she has equal grips. I'm going to go ahead while I'm up at her head here and just take a look at her eyes. I'm going to just remove your glasses here. Guys, if you try to shine a pin light with the glasses on, you're just going to get a glare. Okay, so you really want to just look at her pupils. And just looking at them, I can see that they're about 2 millimeters, which is good, and they're equal. Okay, if there was one larger than the other one or something like that, that would be concerning. Okay, they're equal, round. So next I'm going to go ahead and just check her reaction. Sometimes you may have to dim the lights or maybe even close the blinds. Sometimes you get a lot of external light coming in, and sometimes the pupils will already be constricted enough that you're not going to be able to see the dilation and constriction. So if you need to kind of shield their eyes, that's fine from that light in the room. Just make sure that you're comparing both sides, okay, as you're doing that. So I'm just going to kind of shield her eyes, be kind of a bright light shining in here. I'm going to do one side, and I'm going to come around to the other. And I can see that both, when I shine the light in her eyes, both of them constrict and then dilate at the same time. Next thing I'm going to do is just check her accommodation. And so what I want to have you do is just maybe focus on that electrical outlet in the distance.
Okay.
And then I'm going to have you look back at my finger. Good. And back at the electrical outlet. And then back at my finger. Good. And I can see when she looks at that distant objects that, again, her pupils dilate. When I look at the one, when she moves her eyes to focus on something closer, they do constrict. Okay, so I can say that she is Perla, okay, at this point. So that's another good finding. Another thing that, of course, I would do at the beginning of my assessment is assess her vital signs. Okay, again, that can play a part in her neurological status, and we'll say they were all within normal limits. Okay, next thing I'm going to do is just take a look at her legs here. And just like I tested her strength in her upper extremities, I'm going to do the same thing in her lower extremities. Can you go ahead and push against my hands with your feet? Good, and they're equal. And go ahead and pull back. Good. So I can see that the strength is equal and strong in her lower extremities as well. Another thing that you may want to do is assess her ambulation. Okay, are they able to have a steady gait when they get up to the restroom and come back? We'll say that we observed her doing that her gait was steady, it was balanced, nothing out of the ordinary, okay, in that situation. So at this point, we can see that she does have equal strength. She's able to move appropriately. I don't sense any weakness. Her pupils look good. She's oriented. You said you did have a headache?
Just a little headache.
Okay.
Yeah.
And what would you rate your pain on a pain scale from 0 to 10?
Probably about a 3.
Okay, good. Do you feel like you need anything for that at this point?
Not at this point.
Is there anything that seems to make it better or worse?
Just resting is helping a little bit.
Okay. And the pain, did the pain just come when you fell?
Right.
You haven't had a headache prior to that?
No.
Okay, very good. Are you taking any medication currently for that?
For the headache? No.
Okay.
I haven't really needed anything.
Okay.
It's not that bad.
We do have a PRN Tylenol order, so
Okay.
if it does get where you feel like you need something, we can do that for you.
Okay.
And you said the pain is just located right in the back?
Yeah,
Just
where
right
that
in the spot.
is, yeah.
Okay. Very good. Do you have any questions for me?
That's all I know.
Okay. I'll be back to check on you.
Okay.
Okay.
Thank you.
Thank you.